You're still tuned to the Saudi Morning Show. So, well, up next we're going to be moving on towards a very interesting discussion, as Suleiman has already ushered in the discussion in the earlier parts of the program. So, well, today we are going to be speaking about the major challenges and opportunities in the healthcare for Saudi Arabia. Well, healthcare is really a major challenge in all different parts of the world, and there's so many of the parts of the world that are known to be having the best healthcare systems until and unless you find yourself being trapped and not being able to understand as to how does the healthcare system work, because sometimes they support you for chronic illnesses, some places they are not supporting you for chronic illnesses, and it's really quite confusing. But anyways, healthcare is a top concern, whether you are coming from a country where it is very well supported to a country where it is not so very well supported. But however, with this, we would like to welcome into the studio Mr. Mounir Marhaba, who's an international health and business executive and as well as a knowledge broker. Assalamu alaikum and a very good morning to you, Mr. Mounir. Thank you for joining us.
Wa alaikum salam. Thank you for having me. Pleasure.
So, Mr. Mounir, first of all, as we welcome you into the Saudi Morning Show, and as we mentioned, we are going to be speaking about the challenges of healthcare in the Kingdom of Saudi Arabia. How is it that you get to see it?
Great. Well, thank you very much. From my perspective, again, healthcare is very important. Being a Canadian, healthcare in Canada, of course, can make or break any government. As a matter of fact, people have lost that function as a result of not delivering based on expectations. I think the same stands true in Saudi as far as the importance of healthcare. I've had the opportunity to be here for almost 10 years now, working with a number of major, projects. And that has given me a bit of a privileged insight into some of those challenges. And as you said earlier, it's quite very complex. But right now, again, the transformation and the transitioning both are happening at the same time in the kingdom. And I think with the steadfast leadership, hopefully the intended goals will be achieved. But it's going to take time. It's a journey and not an event.
Indeed. And Mr. Mounir, you were mentioning that as a Canadian, the healthcare over there, people are considering whether medical school is one of the top 3 around the world. This is definitely a major milestone and a great achievement for any nation to be, especially the healthcare nowadays is being compared as one of the role models. But here in the Kingdom of Saudi Arabia, we are very ambitious. We are pushing, especially under the Coastal and and the 2 deputies, to really be as one of the leading nations in all sectors, moving away from the oil sector and focusing on many sectors. Like as we mentioned, healthcare is one of the priority one. How do you feel that compared to your experience overseas? How do you see the kingdom in line of moving with that?
I think the concept of health and wealth go hand in hand together. So if you want to prosper as a nation, you need to make sure that your population is healthy so that you can have the productivity that you need across these different sectors. The economic shifting into diversification right now from oil to other industries is, of course, the strategy for 2030 that the kingdom is aiming for. That's basically a number of parallel processes, each a journey of their own, very complex to address individually. But I think the common denominator there is to make sure that the people of Saudi Arabia are receiving the best health care that they can afford to meet the services and needs that they have and they deserve to actually expect. And I think that is what the kingdom has embarked in doing, along with the other countries in the GCC, in investing in major national health infrastructure projects and also in building capacity. And I think the number one challenge is that capacity building to ensure that you have a competent, capable workforce to actually deliver these services beyond just buildings.
Certainly. Now, let's say, Mr. Mounir, when we speak about Saudi Arabia, now Saudi Arabia is a huge kingdom, but when we speak about your background and your experience coming from Canada, now Canada is really a huge country as well. How is it that we can have a distribution of healthcare which is going to be equivalent? Let's say when we speak about Canada, is it the same for all the provincial areas as in central parts of Canada? Because this is something that we do consider a big challenge for Saudi Arabia.
Right. I think the parallels between the 2 countries are actually not as far away as you might think. size-wise, from a population perspective, Canada and Saudi are almost the same.
Yeah,
Geography,
your
of course,
land face,
it's
yes.
much bigger.
Indeed.
But I think the challenges remain the same in terms of the distribution of services. In Canada, what we have put in place over the course of the age of the nation, which has been there a bit longer, is legislation and policies that allow us to ensure that the rights of people accessing services are provided equitably across. So we have something called the Canada Health Act that guarantees a number of conditions for which health services are provided to any Canadian, irrespective of where they are and irrespective of ability to pay. Okay, so in the Canadian context, each of the provinces has the responsibility to actually deliver health care. But the federal government also contributes money, and as a result, they can also bring with that money certain conditions to ensure that the standards and levels and quality of services are done the same across the country. So I think legislation and policy is going to be very important, coupled with a very strong, robust funding system in place that will allow you to actually manage the system properly. Just funding the healthcare on a per capita basis or on a lump sum increase every year, 10%, 5%, whatever, is actually passé. It's not efficient, it's not effective. In Canada, for example, specifically in Ontario, I've had the privilege of being involved with an entity called the Ontario Joint Policy Planning Committee, whereby we've developed an integrated funding formula that allowed for the first time the government to understand what are the needs of the patients in the population, and then how to couple those with the actual resources required to meet those needs scientifically and efficaciously, and be able to be in a position to predict volumes for the different facilities and fund them according to those volumes based on some KPIs, the key performance indicators that were developed for those hospitals as part of a contract. So if during the year the hospital meets those contracts or goes beyond those stipulated objectives and KPIs, then they receive their money plus. If not, then they're actually paid less. So the point is that you don't want to pay an organization just for its history, its reputation, or habits, but rather for what it is that they're actually doing. And that aspect is key, so that if you can measure it, you can manage it, which is currently a major challenge, I think, for the Saudi healthcare system. And the government, I know, is taking some steps to try and augment that, but it's going to take a while.
Indeed. And Mr. Mounir, what are the challenges do you feel that the Saudis are facing in the healthcare? Because I've noticed one of the aspects was that there's major hospital branches. For example, we're talking about the government, not private.
Yes.
We have major hospitals, university hospitals, or major hospitals. Then we have primary care centers, like many around the world.
Yes, yes.
But I feel like this is one of the issues that many of them are not utilizing primary care centers. They're not using the clinics. Is that something that you've noticed?
I think in answering the challenge, I think access to services that are organized along a certain level of a chain of command, if you wish, whereby primary health care is where you go first, and from there you get referred to secondary and then to tertiary or complex care. Needs to be there rather than jumping the queues. This way you cannot control it. In other words, you want to basically have the patient at the right place for the right cost with the right expertise, and not bringing somebody who's got a simple cold going to a very expensive ER of a tertiary care facility, for example, to get a simple Panadol and sent home, and at the same time having to wait a long period of time to actually get that service because they're not necessarily critical. So the patient education side is required. The government processes and policies and organizing the system needs to take place so that you can take care of the access in the right time, the right place for the right patient, and at the same time, of course, as I said, delivered by a very competent and capable staff, which is part of the capacity building, which is, I would say, one of the major challenges that also need to be overcome.
All right. Now, Mr. Mounir, let's say, though this is not part of our plan of discussion for the day, that
Yes.
we draw comparisons between Canada and Saudi Arabia,
Yes.
because of course there are lots of the different kind of medical conditions which could be more prevalent in North America in comparison to our part of the world, but nonetheless. So for instance, in Canada you have a population which is not as young as Saudi Arabia.
Yes.
What are the differences in the challenges that we have here in Saudi Arabia? Do you think that if we are going to have a good distribution of primary healthcare facilities in the kingdom, that we would be able to, in the long run, cut out on a lot of the big or perhaps maybe even massive expenditures, because so far we did not have a good primary care setup. So you would be treated if you have cancer, but it's more difficult to go to somebody if you have got a cold.
Yes.
So do you think if we have more emphasis on primary healthcare now, that it's going to be saving the government eventually a lot of money later on?
As a matter of fact, it's part of a needed realignment of the system, because you have a lot of duplications, and there's actually right now some emergence of discussions that there's oversupply of services, for example, in the GCC areas. In terms of number of beds, and people are worrying in terms of how to fill it in. So they're getting into global medical tourism, for example, try and augment that. In Saudi, on the other hand, you have to look after your own before you start thinking about bringing medical tourists into the country. And I think, as I said, by having a proper aligned system backed by policies and appropriate legislation that are enforced and monitored by the government, then you'll be able to say that a primary healthcare system will play its rightful role as the principal intake of patients, and then the traffic cop basically to refer appropriately to the rest of the system. That sort of realignment will indeed achieve what you're saying, which is using primary healthcare, which is cheaper and more efficacious for most of the situations, and leave the expensive services for those people who actually need it. Plus, at the same time, you need to align some of the other parallel services also delivering healthcare. You mentioned about the university hospitals. Right now, a lot of these universities hospitals have been built, but a lot of them have not actually been fully operational yet because of the cost. So sustainability is going to be the critical thing. When you want to have a system, you need to be able to know that you can afford it over a period of time. So that sustainability comes from proper funding. And the funding has to be tied to the business planning and how services and how people will move amongst those services. So I think in Canada, we're trying to do this right. Despite our successes, it takes a lot of hard work. And I think Saudi can learn from Canada and other countries, but to do it specifically for Saudi Arabia in the way that's more appropriate for the Saudi situation, and not necessarily just transplant something that maybe works in Canada but may not be necessarily appropriately for here.
Indeed. And for the moment, I would like to thank you so much, Mr. Mounir, especially regarding you brought up some of the major challenges and opportunities, especially in healthcare, because for us to find a solution, we need to know what's the actual problem for any system and for any infrastructure, something very important. Any final words about the future plans in the healthcare term or the healthcare infrastructure, especially in the Kingdom of Saudi Arabia? Any final words regarding that?
Yes, I think the importance of healthcare delivery is going to continue. The demand is going to be increasing, and the ability to manage an effective partnership with the private sector to basically get into the process of balancing the responsibilities and the delivery is going to be there. This is an evolutionary process. As I said, it's a journey. It has begun since 1954 when the Ministry of Health was formed, and will continue. So I hope to be part of it and do my little part to maybe assist in the process.
Indeed.
Thank you so much.
Thank you.
With this, Mr. Mounir, once again, we would like to extend special thank you for joining us here in the program.
My pleasure.
And we hope to see you back again here in the studio
Inshallah.
of Saudi Morning
Inshallah.
Show.
I look forward to that.
So we were in discussion with Mr. Mounir Marhaba, who is an international health and business executive and as well as a knowledge broker. He was speaking to us about the healthcare system in Saudi Arabia. What are the challenges which it could face, it may face, or perhaps challenges that we can get prepared for in advance. But anyways, with this, we hope that the healthcare system would continue to evolve and become better here in the kingdom with the right distribution of healthcare services all across Saudi Arabia. But well, with this, putting a wrap to this discussion, we are going to be moving on towards our next, which is about the 7th Annual Forum of the Medical Researchers on Cognitive Economy. Joining us would be our distinguished guest right after this short break, in which we are going to be witnessing a theme report. Stay tuned.